Hello and welcome to today's webinar, Staying Safe and Healthy Even in Difficult Times. Thank you for taking time and being here tonight. I am Remy Kayode, the Education Lead for NSF UK, and I will be one of your two moderators for this evening. The second person is Kemi Ogunbanjo, a member of NSF UK and the current president of Our Lady of Apostles Secondary School, Yaba, UK branch. For the benefit of those of you that are joining us for the first time, I'd like to inform you that NSF UK stands for Nigerian Schools Foundation, and it's the umbrella body for Nigerian All Students Alumni based in UK. And the mission is to connect people, promote awareness, and develop communities. As we go through this session, please feel free to put your questions in the Q&A box where our panelists will provide answers either in the course of the session in the chat or after all the presentations been given by the speakers. Please note that as usual, this webinar is being recorded and is streaming live to YouTube. Tonight, we have 4 speakers with vast experience between them. Each one of them will be presenting different aspects of what it takes to staying safe and healthy in difficult times. I would now like to introduce our first speaker, Dr. Taiwo Akinseye, who will be speaking from a GP's perspective. Dr. Taiwo is a London GP with postgraduate training in medicine and general practice. He's a lead for drug and alcohol addiction. Dr. Taiwo is also a pastor of one of the churches in London, Victory Church. Please welcome Dr. Taiwo Akinseye.
Thank you very much. As I've said, it's been said, I'm a GP in East London, and I'm going to be talking to us today about staying well and healthy in difficult times. I'm going to just share my first slide. Next, please. Next slide, please. Next slide. Thank you. The first slide, please. The first slide, please. Thank you. COVID-19 is very real, and it's here, and there's not much we can do about the fact that this virus has come around. We cannot change that fact. Many people have been affected. Many more will be affected. Many have survived COVID-19. Sadly, some people have died. I am most grateful to NSF for putting forward this seminar to give us the opportunity to learn a few things that will hopefully give us some wisdom to stay well and healthy in these difficult times. Next slide, please. Okay, next slide. Thank you. So I'm going to be sharing with us some data very quickly about what we've seen at our end in terms of data collected. We know in terms of the sex distribution, this survey was taken in the first 3 months of the first wave of COVID-19 in the UK, in East London, and over 20,000 patients, those that survived and those that were infected, suspected and infected cases. There was a slightly marginal of women affected than women, 53% to 47%. Next slide, please. Next slide, please. This shows ethnicity variation. All I'm just going to say about this is that all races and ethnic groups were affected to a very large extent. Next slide, please. This is a graph showing how it affected different age groups. No age group was really spared. We see a peak of those affected between the age of 30 and the age of 60, but it affects all age groups. Next slide, please. This is a slide showing the mortality rate, the death rate, showing a higher incidence of those dying in the older age group, and there was a slightly higher death rate amongst the men than the women. Next slide, please. This is a slide showing the importance of pre-existing conditions. This is very important because of the immune status that comes with many of those pre-existing conditions. Hypertension, diabetes, chronic kidney disease top the three most disease conditions that was associated with increased mortality, increased death rate. Next slide, please. I want to briefly talk about mental health and COVID-19. This has been quite significant. My own personal experience about this at the peak of the incidence, calling about 40 to 50 patients every day. Majority of the patients that were feeding back had very minimal symptoms, but the majority of what they were concerned about was their anxiety and the fear of the virus, the fear of living alone, the fear of them losing their jobs and staying indoors. So it was no surprise that Public Health England, next slide please, that Public Health England confirmed that 82% of the population were very worried, and 49% of the people in the United Kingdom reported very high levels of anxiety. To this effect...
So you have exactly 3 minutes left.
Okay. And so what are we going to be doing about this? My main message is still the same old message. We need to stay safe. Next slide, please. We need to stay safe. We need to stay alert. Next slide, please. Can you show the slide showing, next slide. Next slide, please. We need to stay safe. We need to stay alert. We need to stay sensible. So these are the message that should be going around, that we should be maintaining social distancing, washing our hands, wearing a mask outdoors and in enclosed spaces, avoiding large gatherings. Next slide, please. Next slide, please. Vitamin D supplements. This is very important. Our dark-skinned population have low vitamin D levels. We know vitamin D is necessary for normal immune function. And we know that those who have high levels of vitamin D do better in treatment when they get COVID-19. I now prescribe vitamin D supplement maintenance for all my patients. There's not enough sun in the United Kingdom, so a message that I want people to be taking away today is vitamin D supplements. Next slide, please. Next slide. Thank you. And finally, I want to just let everybody know that your GP practice is open. We're getting more problems actually now with non-COVID illnesses than with COVID-19. It is important for us to recognize that life is still going on, and many people are still having problems with their diabetes, their kidney problems, their blood pressure, and these all need to be controlled and kept really well so that we stand and have a very good chance of fighting off COVID-19 if we do indeed get it. I am going to stop here. There is an element about mental health that I'm sure many of the other speakers will address, but my message is COVID-19 is real. COVID-19 is here to stay with us. COVID-19 is not going anywhere soon. We need to stay safe. We need to stay alert. We need to stay sensible. And we will all stay well and healthy and help all of us go through these difficult times together. Thank you very much.
Thank you, Dr. Taiwo, for that. Thank you very much for the information that you have shared. I'd like now to introduce our second speaker, and that is Dr. Lola Dare. She will be talking about how to respond and manage an infodemic within a pandemic. Dr. Lola is an award-winning global health and community physician and the president of Chestrad Global. Dr. Lola Dare is also a fellow of the Faculty of Public Health, FFPH. Dr. Lola has only recently been appointed to the board of the Geneva-based RBM Partnership to End Malaria. So let's welcome Dr. Lola Dare.
Thank you very much for inviting me. I'm just going to take off from where Dr. Akinseye has stopped. It's a privilege to speak to so many people and to be within your distinguished audience. Dr. Akinseye said 82% of the people were worried and 49% experienced anxiety. Can you wonder why? In this pandemic, there was an infodemic. The infodemic meant that people heard a lot of things. But before I go on, let me just give you a few definitions. What is an infodemic? An infodemic is excessive information concerning an issue with rapid spread of information, of misinformation. The pandemic across countries, the epidemic, much more than we expect among a population in a region at a time with RR greater than 1. A disease of public health significance or interest, reproductive rate less than 1. There's also another set of definitions. The difference between a fact is known or proven. An opinion is your judgment. It can be based on your personal circumstance or your understanding. It could be right and it could be wrong. A myth is a widely held false belief, and fake news is what it is. It's deliberate misinformation, and the social media technology of information makes it very easy to spread something that is sensational, dishonest, and outright fabricated. This shows you the different curves of the epidemic and the fact that the epidemic has been very diverse, affecting different people and different countries in different ways. In Africa, we have been spared the onslaught that was expected, where we expected a much higher epidemic curve. So we don't have a high epidemic curve. In some countries, the epidemic curve has risen and has tapered up slowly. Germany has a different curve, Italy has a different curve, China has a different curve. So the epidemiology is very diverse. It gave the opportunity for us to share different things. Trump started Chinese disease, Lysol. Government started blaming each other. Melinda Gates said we're going to pick dead people on streets. Bill Gates was going to do a vaccine and was going to only try it on Africa. We attacked WHO and poor Tedros. He was fed up. And then social media gave rise to different things. Many social media epidemiologists evolved. I have a friend who is in advertising. He's just even shared something today on hydroxychloroquine. He knows nothing about hydroxychloroquine, but he just has an idea. And he's sharing it, he has a lot of following and people believe it. 5G, conspiracy theories. And in Africa, because it came in through people who traveled, we felt it was a rich man's disease. And then there were the anti-vaxxers. There are loads of anti-vaxxers in Africa as well. And people didn't want to be vaccinated. They'd rather drink efirin and garlic. Then Madagascar came up with a garlic, with a herbal cure. And finally, we had a group of people to mask or not to mask. One day we're masking, the other day we're not masking. And so we were not sure if we were going to mask. This environment of this infodemic, especially for us in Africa, expressed itself within fragile and diverse health systems. No country health system was ready for the pandemic. It's a new disease, we need to learn about it, and we all quickly learned. These countries with stronger systems capacities learned faster. With a strong system capacity, there's also better education. So there was also less impact of the epidemic, but quite frankly, nobody has been spared of that epidemic. What's the magnitude and reach of the COVID-19 epidemic? Like I said, the epidemic has been variable. In 5 months in Nigeria, we have only 41,000 positive cases. America has 4 point something million. But in 9 months, We have 16 million people in the pandemic, but the infodemic has affected 7.8 billion people. In 1 week, social media is going to share things all over the place. And you can have some, even in 1 day. I mean, I had people drinking Lysol when Bill Gates said, Trump said you should drink Lysol. We had people like chloroquine maxed out in Nigeria in under 1 week when everybody thought chloroquine was the treatment for COVID. So the infodemic was multiple, it just wasn't one, and it was affecting 4.8 billion people, 7.8 billion people. I doubt if any one of us has been spared of the impact of the infodemic. What was the first reaction? The first reaction was an erosion of a fragile public trust. There's no country in the world where we trust our politicians anymore. COVID-19 hasn't helped us. The implications of the pandemic was the application of fear above science. For policy, it was an epileptic application of science and evidence. For legislation, it was legislative knee-jerk. And in Nigeria, there was an NCCD bill. The NCCD bill, the communicable disease bill, was to arrest anybody on the road who refused to be vaccinated. And that also meant that we elicited poor immunization control. We shifted resources for allocation from health services to COVID-19.
Doctor, exactly 3 minutes left.
The economic meltdown didn't help us. We had inappropriate application of economic and social protection palliatives. For people I've mentioned, but the most important thing was COVID-19 stigma, which meant that people don't want to go to seek healthcare because they don't want to be COVID positive and locked up in an isolation center. And then hospitals refuse to give healthcare. And then there are mental challenges. Of course, the mental health challenges are significant. I'm suffering from it as well, and I don't want anybody to come into my household. And I have friends who have just sacked their drivers, sacked their staff, and just locked up offices because they don't want to have catch COVID-19. WHO has responded by creating a new discipline called infodemiology. Infodemiology is supposed to help us social listening, deliver high quality health information, apply appropriate interventions, monitor the environment, support healthy behaviors. We in Chestrad have launched the Come COVID project. It's a resource hub to support community collectives and citizens' action, such as what you're doing. We are reaching citizens and we are providing information for them. The hub should be active in the next couple of weeks. Finally, I'd like to end and tell you, not everything you read is correct. For everything you do, fact check. Fact checking helps us to build public trust. It tells us to be specific in our response. You are responsible for what you share. Don't forget, the information you share can kill somebody because it takes inappropriate action. You need to check that the sites are other sites reporting it. You need to be clear if somebody is reporting an opinion or a sensational news item. For yourself, you need to be clear to yourself, is this my informed opinion or is this a fact? Anything else is a myth. I'm going to leave you with these fact-checking sites. There are many of them: WHO, Bupa, Worldometer, McKinsey, Full Fact, UK government, CDC, NCDC, and African CDC. We are also a fact-checking site. I think that is very, very important for us to validate your information from a fact-checking site. Finally, look out for the PIF tick, Trusted Information Creator. The internet is increasingly, because of the COVID infodemic, putting out trusted information creator labels on certain websites. Look out for it and check out your information. Thank you for having me.
Thank you, Dr. Lola Dare, for that brilliant presentation. I'm sure that people will have taken one or two things from what you have said. Thank you so much. I would now like to invite our panelist, Dr. Tumi Imovore, to give her comments in addition to what we have heard so far from the two speakers. Dr. Tumi is a UK doctor. She has integrated BSc in Global Health, postgraduate certificate in leadership for healthcare professionals. She's also the co-founder of Yorubalism and a writer for www.tumithekoko.com, medical think pieces and social commentary. Welcome, Dr. Tumi Imovore. Over to you.
Hello, everyone. Good evening. It's really nice to see that these kinds of sessions are taking place, because I think the messages that we've had so far from Dr. Taiwo and Dr. Lola are very, very important. One point that I would like to make first for Dr. Taiwo is to ask about the fact that you just addressed mental health. The information that we have and research shows that Black people are actually disproportionately represented in mental health institutions in the UK. So I would just wonder if you could maybe shed a little bit more light on how people can best support their family members or loved ones or relatives or friends that they think may be suffering from mental health conditions. What's possibly one of the best things or the best ways people can support? And my question for Dr. Lola, I think it was very brilliant that you gave us a lot of fact-checking websites to look at, because we're all aware about the fact that we have so much, especially on WhatsApp. I would say WhatsApp is probably one of the biggest infodemic platforms that we have, where you see a lot of information quickly being shared. But how can we make sure that how do we juggle the fine balance of, in a time like this pandemic where information is changing so quickly, what's one of the things that you would also advise for people who also are fact checking, but maybe are not well versed with the kind of information? What would you say are some of the best things that people should be looking for when they are fact checking their information? That's all from me.
All right. Thank you, Dr. Tumi. I think Dr. Taiwo and Dr. Lola has already taken note of the questions, and they will answer when we get to the question and answer time. Okay, is that okay? Thank you. Thank you for that. Thank you. So, ladies and gentlemen, I would like to introduce our next speaker. That is Dr. Anjeku Amadi Obi. He's going to speak on health awareness and how to use technology to help yourself. Dr. Amadi Obi is an emergency medicine physician and health scientist. His professional experience spans Africa, Europe, and USA. He's a fellow of the Royal College of Surgeons Ireland, and he's the founder of Hudibia, a company that uses emerging healthcare technology. Please welcome Dr. Amadi Obi.
Hello, good evening. Thanks to NSF for inviting me. It's a privilege to talk to all of you about what I'm doing and a little bit about healthcare. Next slide, please. Technology has undergone huge amounts of changes in recent years, and its role in healthcare is only just being explored. In this talk, I'm going to talk a little bit about three aspects that might be of promise in healthcare. That's telemedicine, the internet and social media, and the mobile phone, and which seems to be probably the most promising part. The internet has been explored by previous speakers, so I won't really dwell very much on it. Next slide, please. Now, telemedicine just refers to remote consulting, which means that the doctor is in one place and the patient is in another place. Because of social distancing rules, etc., we have had a very huge growth in telemedicine, both here and in Africa. But its function is a little bit restricted by that distance. The doctor cannot touch a patient and the doctor cannot intervene. And at the moment, all the monitoring systems that you can do remotely are not commonly available. So it becomes a bit of a challenge. Although it can be used, it's been very effective in augmenting other services. Like in Nigeria, a lot of ICUs in Nigeria don't have any intensivists. So they resorted to getting intensivists from the UK and the US who monitor their services by telemedicine. And a lot of virtual clinics are being done, especially here in Europe, to augment the services of, especially for people who cannot go to the hospitals or even see their GPs. And now my particular interest in telemedicine is actually where I did a fellowship in telemedicine, because I thought that would be a very useful thing that we can use. healthcare in, so, sorry? We can use that to augment healthcare and, by integrating diaspora physicians, where a lot of Nigerian doctors are based abroad. So we can use that to integrate into healthcare in Nigeria. Next slide, please. Now, the internet, this has been discussed quite a bit. There have been, you should be really very careful how you access the internet for healthcare purposes. A lot of people use Google. That is a very blunt instrument and is terribly unfocused in what it will give you, what information it gives you. Most of the other healthcare services would have their own sites, like the NHS has the NHS website, some of which is devoted to just the Joe public who will be able to access certain information that will be useful. In Nigeria, the NCDC is probably the leading edge of using the internet for healthcare. A lot of information on their website, and they even have a system where they can text you with information on things happening, especially during this COVID period. The CDC is one of the very important site that is really basically a US site, but it is accessed by almost every other healthcare professional worldwide. Also, of course, the WHO has its own website, but it can be quite complex to access things. Now, as mentioned by previous speakers, social media, you have to be very careful how you access that and what information you access that. I would restrict it, for example, to verified sites of particular services like the NHS. Next slide, please. Now, the mobile phones, everybody has a mobile phone, and it is probably going to be the future of healthcare access, especially on a technological basis. Most mobile phones have particular health apps that are very useful. You can even put in your information on the phone. If somebody collapses, you can very easily access that information, like whether the person is diabetic, is in insulin. So these things would be useful even just by putting it on your phone. The accelerometer and the GPS on your phone actually monitors your activity, even though you haven't turned it on. They should be able to tell you how many steps you've taken, and some details that might be able to enhance your ability to access what type of healthcare you need. Now, the apps is also one of the big promising areas.
Doctor, you have 3 minutes left.
Okay, so a lot of the apps would be for healthcare. They are targeted apps that you can use. And then there are accessories like glucometers you can attach to the phones, and blood pressure monitors, heart rate monitors, and others. Next slide, please. So a lot of these are just a few examples of some apps that you can find in the App Store, such as MyFitnessPal is the most common one, calorie counters. Next slide, please. So Hudibia is what I am working on. It's a healthcare app too. This is just the home screen showing a lot of what it does. You can find doctors, you can order medications, you can search for hospitals, and you can find healthcare information directly on it. Next slide, please. So these are just a few of the features on the Hudibia app. You can search for doctors either by specialties or by name. When you find the doctor, the second section there shows what it looks like. You can directly book an appointment with the doctor. But especially for people who are living abroad and you have relatives in Nigeria, you can actually find a doctor, pay for their services. For your relative, you'll see where it says pay for others. That's for your relatives back home. You can actually access it and pay for their services without having to go through Western Union or anything like that. Now, you can also directly order ambulances. Like if you're talking to some relative back home and you think that they're not sounding so well, you can actually directly order ambulances on the app, put in where you are, where they are located, and put in where you want them to go. And those will be, as long as you pay, and then the service will be provided in Nigeria. The last panel there is about health information. Directly on the app, you can see that you can search for various healthcare information. This is a reliable information that you can get. But uniquely for the Hudibia app is that you can actually if you're not able to read it, you can actually click on it and it will pull up Hausa, Igbo, or Hausa, and then you can just play it as a voice memo that you can listen to. Next slide, please. So in conclusion, well, technology has been a huge enabler of people, a lot of individual empowerment with all the things you can do with it. You can personalize your healthcare. So everything is no more, you go to the hospital, you get a chart. Everything you do is focused on what that individual is about. And there's the quantified self, which is now big. People can now do quite invasive analysis, not necessarily invasive, but a lot of analysis on on themselves, like oxygen saturation, which has been very useful with this COVID. A lot of people now have oxygen sat probes. You can get, of course, monitor your blood pressure. You can monitor your heart rates, and a lot of these upcoming analysis. However, all this information and data can also have a big problem. For example, if your employees get hold of your—
Doctor, you need to round up.
Yeah, so, well, if your employees or insurance gets hold of any of your information, well, they can use it for their own purposes. So, well, I think I can stop here now. And okay. That's the last slide, isn't it?
Thank you, Dr. Amadi Obi. Thank you so much. I know you've got so much to give us, but for the sake of time, we appreciate what you said. And we're going to move on now to our last speaker, and that is Dr. Mary Ohewere. Dr. Mary Ohewere is going to do a presentation about protecting our well-being, and she will be giving us some practical tips as well. Dr. Mary is a mentor, a medical doctor, and a humanitarian. She's the Deputy Director of Public Health, and she leads on the local response to the COVID-19 pandemic. She is a fellow of the Faculty of Public Health, FFPH. Please welcome Dr. Mary Ohewere.
Thank you, and good evening, everyone. So we've been in a pandemic. We've been assaulted with information and misinformation, an infodemic. It was a global health emergency, and we were ready to fight or for flight. And that emergency was vital. We needed it to respond quickly to survive. And even now, there's talk about a possible second wave, a further lockdown. Amidst this are concerns about income and job insecurity, redundancies and unemployment. To navigate the months and years ahead, we must be intentional about our health and well-being. So moving on, I'm going to say to you, let's get out of emergency mode. It's time to rebuild our resilience. We've got some really important adjustments ahead, some choices to make, and staying in emergency mode for a long time is bad for our health and well-being. So today, make a decision to get out of emergency mode. You may not feel like it necessarily. It's a choice to change our attitude and accept where we are now. What do I need to do? What are my options? What is in my control? All right, so there's going to be ongoing uncertainty. But you can focus on what are the things you do to maintain your resilience. So take a deep breath and then exhale. Smile, because you need to reclaim your life. You don't hand it all to the pandemic. At this stage, we're the survivors. So it's not about a feeling that there's no pandemic, and it's not about denying the current situation. It's making a decision to go forward. So moving on, I will say to you, guard your mind. As Dr. Taiwo said, lots of people are worried. And as Dr. Lola said, many people are worried because of misinformation out there. So in guarding our mind, we need to be wise. If we're guarding our mind and we're being wise, then we recognize that our mental health and what goes into our mind, what we ruminate on, affects our physical well-being. So filter the inputs. What are the trusted sites? We've heard about fact checkers. Make choices, make wise choices. Be selective about media, both content and quantity. Be wise and filter the inputs. So we have high levels of anxiety, particularly amongst some of our young adults, people who live alone, as well as people with pre-existing medical conditions. Guard your mind. Guard your mind. Beware, be aware of how you feel and seek help if you need it. Accept help if offered. Are you getting enough sleep? You can't make, you're less likely to make good judgments with insufficient sleep. So I'd say, make sure you get enough sleep. Be selective about what you read and listen to. Be discriminating. Moving on, I would say, get moving daily and go outdoors. Get moving daily and go outdoors. We've talked about vitamin D already, and we know that in our community, we sometimes have low vitamin D. So if that means we need to get supplements, link up with your GP, have that conversation, get the necessary help. Appropriate footwear. Being active does not have to be expensive. You do not have to join the gym. You may, but you don't have to. You can find a friend that you need to talk with and maintain a social distance as you walk around a park or walk to the friend's home. Use a headset, listen to podcasts as you walk. We like to dance. You don't have to get dressed up and go out to dance. We can dance at home. Have young people teach you a dance or teach someone else a dance. There are open spaces. There are loads of things we can do. We also need to eat more healthily. Home cooking is good because we're more aware of the ingredients we use. For people of a certain age and stage, it's an irony of life that just when we can afford to eat out regularly, we need to eat less. As we age, we typically become less active, in which case we need to eat better. And yes, that does include eating less and being intentional about moving more. So get moving, go outdoors. Eat your moi moi, but eat it as a side dish with some salad. We talked about technology. Use your phone to keep tabs on how much activity you're getting. You don't need to buy a special kit for it. Many of the current phones will be able to do that for you. So moving on to give. There's loads we can give. Take a moment and look around you. There are people going through difficult times. You can give to them. Give your time, give your presence. It helps you, even though you're helping someone else, it actually benefits you as well.
Doctor, you have 2 minutes left.
And you're on the wrong slide, so you want to go back a slide or two. Give your time, give your presence, have a chat, make that call, and listen. Moving on is guidance. With guidance, there's guidance about preventing the spread of COVID, about hand washing, cleaning, especially touch points. By that I mean door handles, banisters, using hand sanitizer, the use of face coverings. Know the symptoms to look out for and be alert to their development. Someone confessed to smelling his coffee daily in order to confirm that he still had his sense of smell. Guidance exists about when to isolate. Symptoms, isolate, test. Symptoms, isolate, test. And if you test positive, the guidance says, contact tracers will be in touch. Please share details of where you've been and with whom. This is critical to us, working together to stop the spread of the virus. Remember, symptoms, isolate, test. And while you're isolating, you may need the support of your network, your neighborhood, your church, your community, your schoolmates. This can be a neighborhood network who will check on you, run errands, buy food or medication, or even walk the dog. And finally, the practical things you can do. Get out of emergency mode, guard your mind, get moving daily, and get outdoors. Give, and guidance exists, follow it. Thank you.
Thank you, Dr. Mary, for that insightful presentation. Thank you so much for those tips as well that you've given to us. I'm now going to invite Dr. Tumi again to give some comments. Over to you, Dr. Tumi.
Thank you again to both of you for those brilliant presentations. For Dr. Amadiobi, I think it's so important that we start, everyone uses their phones, everyone has their phones on them most of the time. And even for those on the continent, we know that mobile phone use is growing rapidly, probably more so in Africa than a lot of other places even in the world. So everyone has a phone. And I think what is really important to think about in terms of health is even if you don't have a chronic condition or anything, one of the good things to notice, to take note of is what is normal for you, what is your baseline. And actually there's a lot of apps that can be useful for doing that to track and monitor certain things. But from an expert like Dr. Amadiobi, I think it might be useful to maybe enlighten us on some of the apps or some of the things that you think might be useful for people to monitor regularly or people to take a note of, not excessively, but just in a good way to track and monitor their health. And Dr. Mary, I think that was brilliant that you gave us so many tips and so much guidance on things that we can do that don't drastically change our lifestyle, but can actually make quite big improvements. So things like not necessarily having to join the gym or having to do activities that you don't necessarily like, but just changing and implementing things in one's lifestyle that can actually have really positive impacts. So one of the things I wanted to touch on was food, because I know that especially when we talk about chronic conditions in our community, how our diet influence that is much bigger than exercise. So a lot of people use the 80-20 rule, that it's 80% diet and 20% exercise. So what other tips in terms of, I know you were saying things like portions, but could you shed any more light on any tips that you would give people about things that they can be more mindful of in terms of diet? That's all from me.
Thank you, Dr. Tumi. Can I ask Dr. Mary to respond first, and then Dr. Amadiobi? Thank you.
So I am going to suggest to you that it's 100% diet and 100% activity. I say both because you do need the activity. If you're absolutely the perfect weight and you're eating healthily, your body needs to be active. And however active you are, you also need to be eating the right foods. So yes, you're right, there's something about the portion. There's also something about what we know we're eating. So without wishing to demonize any food, if we cook food from scratch, we know what's gone in the pot, we know what's gone in the pan, we know what we put in the oven, we have a sense of what we're eating. If you buy food already prepared, you don't. So I would say one of the tips we can do is go back to the way we used to eat, or back to the way our grandparents ate. You may not be able to do that every day. And I'm not suggesting you cook from scratch every day, but know what you're eating and eat those foods that are filling. Traditionally, we eat foods that are high fiber, loads of vegetables, appropriate amounts of meat. Just because you're excessively wealthy and comfortable off at the moment doesn't mean that you need to overdo some of those things. But going back to basics on the food would really help.
Thank you, Dr. Mary. Would Dr. Amadi like to make a response to the comments from Dr. Tumi, please?
Thank you very much. I'll piggyback on what Dr. Mary said. The apps that would be very useful to you would be those that would be able to monitor your activity. to start with, actually, your phone itself monitors your activity. So it's probably a good idea to look exactly at what you can do. It can actually tell you exactly how many steps you've taken in a day if you have it in your pocket. If you have it on your table for the whole day, you probably won't be monitoring much. But if you have it in your pocket, it will tell you exactly how, well, not exactly, but estimate how much. Now, there are a couple of additional apps that you can get to tell you, to assess your food intake, how much it is, give you the calorie count on the foods that you're eating. Of course, as you get older, you will need to be get things like that will be able to monitor your blood pressure. These would be accessories, and even rudimentary assessment of your pulse rate will be able to give an idea of if somebody has an irregular pulse rate, for example.
We have 10 seconds left for this section.
And also particularly for women, there are very good apps there that can monitor your menstrual cycle and be very useful for, especially if you're trying to get pregnant, and be able to give you a good idea of when is the best time. But the thing with apps is that they are fairly restricted in what they do. One app does one thing, so it depends on what your requirements are. But on the whole, lifestyle apps are probably the best ones for somebody who is healthy.
Thank you, Dr. Amadi. I'll now hand over to Kemi to do the question and answer session, please.
First, I would like to thank the panelists for this evening's very informative presentations on staying safe and healthy, even in difficult times. Your time is much appreciated. Thank you. We'll now proceed into the question and answer session. And if you don't mind, Dr. Taiwo, if you don't mind responding to Dr. Tumi's question earlier.
Okay,
please.
All right. Thank you very much. A lot has been said, but there's something called psychological first aid, which I want to quickly share. Everyone should be involved in this. We're likely to know somebody who has been affected with COVID, or somebody who is suffering in some way, and we can support each other in this way. So the first thing is about empathizing with people, just trying to understand where they're coming from, and a need to accept and validate their feelings, and listening is a very important therapeutic tool. And lastly, is about signposting and support. This is so important because we need to be aware that talking to people and sharing all the good things that has been shared tonight by all speakers is one of the ways we're going to get ahead and be able to prove ourselves from this anxiety and fears. In our local community, your GP, third-party organizations such as Red Cross, Mind, and Good Samaritans, but to name a few that we can all contact and talk to people that can help support us psychologically. Thank you.
Thank you very much. The other question that Dr. Tumi asked, could you, I think that was directed to Dr. Dare. So if you don't mind, Dr. Dare, if you just respond to Ms. question earlier, thank you.
Tumi's question actually also relates to some of the questions in your Q&A box. How do we manage the deluge of information? I'm going to just go again over some sections of the slides and say validate first. Is anybody else repeating it? Is this someone reporting an opinion, a personal experience, or a sensation? Ask yourself those questions. Is this a credible source? Is the information up to date? Is it referenced? excuse me, an image is valid? Is the message clear to understand? Is there any expert opinion behind this message? I think that due diligence to make sure that you validate what you hear, you validate what you share is very important. In addition, for us, for many people who are back home in Nigeria, you represent experts. You need to be careful that you are sharing the information that they need timely. You need to be careful that you also provide factual information to your relatives at home, and you need to fact check. So those fact checking sites are very important. Also, if you wish and you have the time, WHO does a media briefing every day. And on the WHO website, there is a backlog of media briefing. It's very important for us not to get caught in the sensation and to manage the infodemia. Thank you.
Dr. Dare, while you're there, there was a question asked earlier. Have we learned the lessons from other pandemics? For example, Ebola, SARS, etc. And I'm directing that to you, Dr. Dare.
This is one time Africa was far ahead of the curve. Because we're still coping with sporadic epidemics, and we're still coping with a lot of communicable diseases, our structures to respond for communicable diseases were more robust, and they indeed protected us. In Nigeria, the polio infrastructure was used for Ebola. It was also useful here in gene expert machines and making testing kits also, gene tests available to many people very quickly. Advocacy to the NCCD also ensured that the 100 gene expert machines in Lagos and also used for TB, for HIV, and for polio were available for testing. The second big thing we've learned from every pandemic, from other pandemics, is promoting vaccine acceptance. Polio was rejected in northern Nigeria, and a lot of lessons were learned in risk perception, risk management, which we still need to put into place, but there's an infrastructure to do that through social mobilization. In Africa, community platforms, citizens platforms are also probably more active than you have citizens platform here. So person to person, mouth to mouth, are helping in dealing with the community transmission. Of course, there's a lot more we need to do, but the infrastructure for polio, the lessons of managing stigma on HIV, the lessons we've learned from promoting routine immunization, the lessons we've learned from risk perception and risk management are beginning to come to play as we learn new ones of dealing with higher level things like vaccine production, local production of the materials. So these lessons are actually coming to bear, but we can bring them to bear much better. Here, you were dealing with non-communicable diseases. So your infrastructure for communicable diseases was not as robust besides surveillance and contact tracing, but reaching people one-to-one may be different from what we did in Nigeria, what we're doing in Africa, and that's working for us.
Thank you very much, Dr. Dare. I have one other question, and sadly, this will be the last one. Looks like it may have been answered, but I'll ask it anyway because I think it just warrants a response. And I'm directing this to Dr. Akinseye, if you don't mind. And the question is, my GP once said to me that the reason I have not been able to drop weight could be due to my high blood pressure tablets. Is that correct?
No, I don't think that would be correct. Ola wasn't there. I think sometimes as GPs being very pressurized with time, we don't sometimes take enough time to talk through to patients. I would not say that. I mean, I think what I would say about hypertension is that sometimes we do need medication to control the blood pressure, because the risk of not controlling our blood pressures can lead to things like stroke and heart attacks. And the most important advice that I would give concerning that question is, if there's any doubt, go back to your GP. It's totally open. At the moment, we're having to change with how we're practicing. A lot has been spoken about telecommunication and speaking to people over the telephone, but actually we are seeing people Once they are screened, they need to have a physical examination. We will invite people to come in. We are doing referrals. We are managing chronic diseases, hypertension, diabetes, kidney diseases. Everything is going on along trying to manage people with COVID. So call your GP and speak to them so that they can clarify whatever doubts that you have with regarding your medication. That's what I will say.
Thank you very much, Dr. Akinseye. This one's just quickly popped into the, and I'm going to direct this to Dr. Dare, and if you can just give a 15-second response, please. And it's, we have a strong belief system as Nigerians. How do we ensure our organizations like church and other religious organizations play a part in the infodemic?
Thank you. Our strong belief systems are very critical, and our ComCOVID project is actually working on citizens and community platforms such as the one we are part of. Church organizations, alumni groups, neighborhood associations, including tenant groups, are being engaged through ComCOVID to share information and affect those belief systems. In addition, risk protection also includes working through the traditional systems and our OBAs. And so the traditional system is also an important part of that strong belief. However, our strong belief systems are a double whammy. The erosion of public trust in churches meant that it was very difficult, and the discussion around churches, I want to open up, I want to go to the mosque, even if it is not safe, also meant that we had to rethink how to work with faith-based organizations. So it's sometimes not so great, because they control the minds of the people in a different way than encourage risk protection, but that's changing, particularly in Lagos. The religious organizations are beginning to social distance and put in the kind of structures that align with social distancing and physical distancing in the churches. And so it's we also work with the RCCG leadership to ensure that when Pastor Gio stays at home, everybody also stayed at home and continue their church services online.
Moderator,
so yes, you're absolutely correct. We need to work with those citizens-led platforms.
Thank you, Dr. Dare. Once again, I will just thank the panelists for their time. Your presentation that has been very informative. We've received lots of information. Thank you for that. I'd just now like to bring up that our next NSF function, NSF UK activity, will be on the 29th of August 2020 from 12 o'clock noon, and that will be our fun day. Our next webinar in the Let's Talk About It series will be in September, 24th of September 2020, and that will be at 8 p.m. And details for both of those events will be coming up shortly. On behalf of all of us at NSF UK, we'd like to thank you all for attending this webinar. We hope to see you at our future events. And once again, thank you very much and good night.
Thank you.
If you don't mind just filling in the exit poll that has come up.